Hello everyone, I am Dr. Aditya Singh Bhati, consultant neurosurgeon and spine surgeon. Today I will be talking about seizure disorder. So we all know that seizure is very much prevalent all over the world, even in India also. It could occur in children as well as adult age group. Is there any difference between them? Yes. In children, there are few other causes of seizures. In adult, there are other causes also. So first of all, we'll talk about different types of seizures. Seizures can be focal or generalized. There are subdivisions of that even, but we will broadly speak about two types, that is focal epilepsy and generalized epilepsy. What is focal? Focal is it is a kind of seizure only the face or the limb or any part of the body there is flickering movement of that. That means it is the only focal part which is involved. In generalized epilepsy or seizure, there is total movement of the body with loss of consciousness. It is also associated with tongue bite, uprolling of the eyeballs, bleeding from the gums or the tongue because of the tongue bite, and urine and fecal incontinence. This is generalized epilepsy. Now, in children, are there any different types? Yes, there is also called febrile seizures, in which less than 5 years of age group, when they have high-grade fever, they might prove seizures. So, in that case, when you control this high-grade fever, the seizure doesn't come. And also, there is a special group called as absent seizures in children, in which children give daisy look, as if there is blackout. They just stare at the object or the parents or in the school. That means this could be a epilepsy. So the parents or the teacher have to consult the doctor and even the parents that such is the situation. So how to diagnose and how to manage it? In diagnosis, when you approach a doctor, he will thoroughly examine, he'll take the detailed history, and he probably would suggest an CT or an MRI accordingly along with EEG. So after that, there are different kinds of probabilities which may come up. The main causes of seizures are, it could either be in children or in adult. These are when there is hypoxia, there is decreased oxygen concentration in the brain that could cause seizures. Other is dyselectrolytemia, that means any electrolyte imbalance can cause. Like most commonly, the glucose can go down, and that can also cause seizures disorder. Other than that, when you have hypotension, these are the common findings. Other than that, when you are young, then there may be some traumatic injury that can also lead to it. Moreover, tumors are common both in children and in adults. The tumors can be benign as well as malignant. Most of the tumors which are benign can be taken out, and after 3 years of epilepsy treatment, they can be cured. And in malignant, it will depend upon the grade of the tumor, and the prognosis depend upon the grade of the tumor. Accordingly, the anti-epileptic drugs will continue. So, whenever you see a patient with seizure disorder at home or outside, you must help. You must just see that the surroundings of the patient are safe, so that when he falls down, when he throws a seizure, one must be very careful that he doesn't get hurt with the surroundings. The seizure will be there for minimum of 10 seconds to 1 minute, less than 1 minute. It won't go beyond that mostly. So after that, he might be confused or drowsy for a while. In between, you can call for help, and when the actual seizure is over, he might be drowsy, and you must make sure that he is made to lie down and his head is towards one side, so that the oral secretions can go out. They won't go into the lungs and called aspiration. That's the more important thing. The management, as I told you, depend upon the cause of the epilepsy. I hope this would be useful for you all. Thank you so much.